Paulina Sosa. I'm the founder and CEO of Latinx Voices and the Latinx Task Force. And it is my sincere pleasure to welcome Zelmy Allen, our esteemed colleague and friend from Vaccine Adoption Equity Team, with us today. We are so excited to dive into this really empowering conversation for the community. But first, I want to see if Zelmy, if you wanted to share any opening remarks before we get started.
Yes, hi, Paulina. Thank you so much for having me. And I just want to say thank you just for taking the time to talk to me today and learn more about what Pfizer's Vaccine Adoption and Equity Team is doing across the country and in Texas particularly. So I'm excited to get into this.
Same here, same here. It's so exciting just to hear about all the amazing work that you and your team has been doing around the country, but definitely here in Texas, as I am also based in Texas. So it's really great to work alongside just the amazing efforts you're doing. So would you be able to share a little bit with us on the role of the Vaccine Adoption and Equity Team at Pfizer? And how does it address disparities in vaccination rates within the Latino community?
Yeah, so at Pfizer, the Vaccine Adoption and Equity Team plays I feel, a critical role in ensuring that education and awareness about vaccines reach all communities, but particularly those that have been marginalized or underserved in the past or currently being underserved. So our focus is on driving vaccine equity by partnering with grassroots organizations such as Latinx Voices that address systemic barriers, ensuring that vaccines are accessible to everyone. Specifically for the Latino community, we recognize that disparities in vaccination rates are often tied to issues such as access to healthcare or mistrust of the medical system, and language barriers. That's a very important part of the health disparity in vaccinations within the Latino community. So our team really works to bridge those gaps by building trusted partnerships, tailoring our outreach to meet the unique needs of the Latino population, and collaborating with stakeholders who are invested in that health equity piece. I think that that's what's been successful in the way that we've engaged communities, specifically our Latino communities, because, as you know, Latino communities are not monolithic, meaning they're not the same, right? So I'm based in the Dallas area in North Texas, and I know you're in the South Texas. And although we're both Latinas, we grew up differently. We have culture that ties us together, but our environment plays a role in how we see health and how we take care of ourselves and our families and communities. So yeah, so that's kind of what our team does, and it's an exciting team. Not every day looks the same. Not every campaign or engagement is the same. So we really try to tailor that to the specific community that we're working in.
That's beautiful. And I think, first and foremost, we just want to applaud the efforts of you and of your team. I know that community engagement has really emerged as one of those key strategies that is successful in engaging the Latino community, particularly coming out of the COVID pandemic emergency. We saw that partnering with unique stakeholders that have the trust of families in the community was so critical. And so I just want to applaud the efforts of your team in making this happen and making this a regular part of the work you do. And so thinking about Latino community engagement, and thank you so much for also highlighting the fact that the Latino community is not a monolith. So being based here in the RGV of Texas and you being based in Dallas, we know that there's different slang, there's different ways of talking about different issues, there's different trusted messengers in our communities. And that's the case across the country. And so thank you so much for highlighting that really key component, that the Latino community is not a monolith. And so I know you've shared a little bit already about engaging with the community and some key strategies, but could you share maybe a little bit about maybe a strategy or initiative that has been most successful in building trust and awareness around the specific topics that you bring into these communities and into these different events that you participate and engage the community in?
Yeah, so for us, specifically for our team, we've prioritized building meaningful connections with the Latino community through relevant initiatives. We want to make sure that those initiatives foster trust and transparency. We focus on understanding the unique challenges within these communities and addressing them by providing them with resources like Spanish language vaccine information, hosting educational webinars, also just being present in the community, right? Like showing up, whether it is for a small senior center where maybe 20 seniors show up, I'm still going to show up and give them the best information that I have available for them to make sure that they're empowered to make those decisions around vaccinations. For example, one of our upcoming collaborations is with an organization called Rosas es Rojo, for a Spanish language webinar that is aimed at providing accessible vaccine information for women that have been going through or that are or that went through cancer, right? So their focus is on health screening for cancer patients. However, we all know how important vaccination is as a preventative tool, right? So kind of being innovative in a way that we partner with community organizations that may be doing work around health prevention, but not necessarily vaccine, and how we incorporate those messages in a language that that community understands, right? So we're able to build trust that way, raise awareness that way. So that's mainly how our community engagement specialists work throughout the country, really making sure that those are tailored for their specific community.
I think that is so powerful, the way that you worded the importance around, again, just speaking the language and what you said here, just showing up, just being present for the community, not coming in right when the emergency starts, but being a regular presence throughout the year and within the community and doing that in alignment with trusted messengers. I think that is so critical, and again, just really excited to be able to be one of those partners alongside the work that you and your team is doing. Because at the end of the day, our community and our families really can tell, right? They can tell when you're being real, when you're being transparent and authentic. And so having that built in as one of those key strategies to engage with familias and comunidades around the country is so critical. So thank you all so much for doing what you do and doing that on a regular basis. And so I want to talk a little bit about partnerships. I think it sounds like this is kind of at the crux of a lot of the engagement work that you do. So how has partnering with organizations like Latinx Voices and others helped Pfizer vaccines reach Latino communities? If there's an example that you could possibly share on a successful collaboration or initiative that you've been a part of and really have seen the fruits of that engagement.
Yes, partnerships are really the central key to the work that we do. They allow us to effectively reach and engage the Latino communities by leveraging the trust that they've built for years, right? And the influence that they have over our communities or local communities. So a lot of the work that we've done in the past and that we continue to do, whether it's a health fair, a listening session, a webinar, is through trusted channels. For example, one of the biggest partnerships that we've had a lot of success in is with Amigos Sin Fronteras, and they are housed at the Mexican consulate in Dallas, and every year they have a binational health fair where they bring around 8,000 people, 8,000 participants, mostly Spanish speaking, that have been they're searching for information for health services. So we've been lucky enough to be partnered with them this will be our second year partnering with Amigos Sin Fronteras, and just engaging in such a large and receptive audience, because they are receptive. They want to know. They want to ask the questions. A lot of the times I hear like, well, there's certain communities that just don't want to hear it. It's like, no. They do. They want to hear it. But they want to hear it in a way that is not condescending, that it's not talking down on them, that is in their language, right? So we're not only able to increase awareness around vaccines, but also build that long-lasting trust with these communities, knowing that, hey, I remember last year Pfizer was, out here giving information. They're here again, and we'll be here, so we'll continue to show up and be there, and hopefully be that trusted messenger alongside these organizations that already are trusted messengers in their eyes. So
Amazing. I mean, and what a beautiful example. I think, again, you're really highlighting the importance of showing up, meeting people where they are, and talking to people in a conversation where they can safely ask questions, and they can also safely address additional issues that maybe they have with the information that you give. And something else really important that you brought up, the importance of empowering nuestra comunidad with information. How critical is that? And I'm hopeful that this video also serves as a source of information. But I think that is so critical. And so I think this is also a nice transition into one of our last questions about overcoming hesitancy in our community. And I think you very pointedly addressed this already. But the reality is that many families and individuals in our community do want the information. They want to know what is the best step, what is the next step for them and for their families and for their loved ones. And so, what are some challenges that you've observed in addressing vaccine hesitancy in Latino communities? And how is your team working to overcome those barriers? Any reference to specific resources that you'd like to share at this point with those listening in?
yeah, so I'm sure, we've all worked in the health space and public health with the Latino community. And we know that vaccine hesitancy often stems from like fear and misinformation and just that historical mistrust of healthcare systems, right? One of the key challenges that we face is addressing that cultural and social influences that shape perceptions around vaccines. A lot of the barriers that our team has worked on has been that language piece, that cultural language piece, where a lot of the times the materials that communities get, they don't see themselves in it, right? Even something as some people may call as simple as a picture on a brochure can make the difference of in a community where they would want to learn more, or they're like, oh, I don't see myself in this. This is not for me, right? So making sure that we are well positioned to deliver those accurate messages in a cultural sensitive way, which includes that photo, which includes plain language that they can understand and the language that they prefer. So our team, provides those branded educational materials available through directly through our VAE team or through community partners such as Latinx Voices. I know there's a website that at the Latinx Voices website, there's some of those materials that people can just go and download and use for presentations if you're a community health worker, or if you are just somebody who is interested in learning more at your own pace, right? Because we also don't want to push anyone into doing anything around vaccines, but we want to make sure that they're informed, that they're empowered, that they can go back and ask those questions to their providers. Is this right for me? Is this something that I need, right? Like that is what we want. We want to empower communities to ask the questions, because I know a lot of the time, specifically in the Latino community, we just take whatever the provider says as, that's just what my doctor said, and I'm just going to go with it, or without asking those questions, right? Like, we are timid sometimes and afraid to ask the questions that are important in our health and how we advocate for ourselves. So I think that is the biggest way that we can overcome vaccine hesitancy, is through that education piece, making it culturally sensitive, making it to where people understand it and they're empowered to make those and ask those questions, make the choices and ask the questions. So, we want to make sure that language barriers do not prevent people from getting the information that they need.
Yes, beautifully said. And I think that's so critical too, empowering families to ask questions, right? And you're right. I think language is such a critical barrier that is still not quite being addressed on a national or federal level, but we're hopeful that partnerships like this will bring light to the gap and address and fill the gap, but also lead to sustainable steps for the future. And so I think it is so critical for us to continue to do the work that we're doing to answer the questions that families are asking and make them feel safe to ask those questions. And so, speaking of this and thinking about what's next, I would love to hear a little more about what is Pfizer Vaccine's vision to continue to support the health and wellness in nuestra comunidad. Are there any new initiatives or areas of focus on the horizon that you'd like us to be aware of, and anything else that you would like to share at this time?
Yes. So, Pfizer vaccine adoption equity team, I know for us, it's just continuing to support the health and wellness of the Latino community, right? We want to make sure that our support is deeply rooted in long-term partnerships that address these systemic barriers for health inequities. Overall, one of Pfizer's key efforts is through the Multicultural Health Equity Collective, which focuses on reducing healthcare disparities in historically marginalized communities, including the Latino population. So this is just kind of an example through partnerships with organizations like Dia de la Mujer Latina. They've provided culturally relevant education, early detection screenings, preventative care interventions led by community health workers or promotoras, which have been key to their success in the Latino community. For our team specifically, making sure that we're expanding these partnerships using insights gathered through community engagement, and then continue to support vaccine awareness, vaccine education, and also maternal health. That's been a big important issue that we've continued to, or we've been working and continue to expand on the diversity of education, right, for the maternal health space. So these type of initiatives that we're continuing to support are the core of our engagement as we move forward to 2025. I can't believe that October is almost done and 2025 is around the corner. So just continuing that support, making sure that we are that key partner for our community organizations, and they can look to us as a partner that is not only providing educational resources, but also just listening to their concerns and what they're seeing in their communities is important as we move forward.
Beautiful. And we're so excited to be able to look ahead with you into just all the amazing initiatives and efforts to come. As we've said before, and we'll say it again, Latinx Voices is just so honored to be able to partner with you and your team in a Pfizer vaccines adoption and equity team. To make sure that we're bringing the right information and educational resources to nuestra comunidad y to las familias que están aquí. And so with that, I want to be able to first just say thank you and see if there's any last thoughts that you'd like to share with those listening in. Zelmy.
I just want to say just thank you so much to Latinx Voices for giving just the opportunity to have a platform to talk about the importance of vaccine awareness and education, right? Specifically in the Latino communities, knowing how diverse we are, knowing that, especially here in Texas, how a huge chunk of the population is Hispanic and Latino, right? So making sure that we have outlets with organizations such as yours is so important for us. And we're so thankful to have you as a partner. And I hope that we can work together again. I know 2025 is around the corner, so I'm excited to bring the latest information and making sure that, as I said earlier, we show up, right? So just want to say thank you, and I hope that we can, talk soon.
Sounds great. Thank you, Zelmy. And we're also excited about 2025. I can't believe we're already in the month of October, but we got so many exciting things ahead, and we're excited about what that means as our partnership continues to blossom and as our efforts in Nuestra Comunidad continue to grow and to expand. And with that, I also want to thank everyone that's listening in. Thank you for your time. Thank you for sharing this information with your colleagues, with your friends, and with your family. We will be sharing resources that have come out of this conversation below in the link. So please share those links with those that are listening. And again, a big thank you to everyone for all of the work you do. A big thank you to Zelmy and your team at Pfizer for the work that you do. And with that, we thank everyone. Nos vemos pronto y gracias.